So starting off with a couple of simple ones. The idea of a slip disc and the idea of the myth of your back going out. Now, the idea of a slip disc has been around forever, and it's a really old and outdated concept, and unfortunately it still persists. And I find it a little bit scary to hear of health professionals that use that kind of language, because it's no secret that the discs aren't disc-like at all. When I think of a disc, I think of like a hockey puck, you know, something that's solid and that's quite separate, but they're not like that at all. Discs are really bound to the vertebra above and below. They blend in with the periosteum, they blend in with within themselves, and they're certainly not an inanimate object like a hockey puck. So they can be injured though, they can certainly be injured. You injure a disc in the same way that you can sprain your ankle. You know, it's soft tissue that can be stretched. They wear, they get older as we get older, they lose moisture, but they don't slip, and it's a really important thing to remember. So, and I think discs is a really ordinary name for them anyway. I don't know what it would ever be replaced by, but anyway. And your back, similarly, your back doesn't go out, and this is a really pervasive term that's out there. And I get the idea that it can feel like your back can be out, and it can feel like it needs to go back in. But the reality of the situation is everything, as I'll show you, is really tightly bound together. There's no room for things going out and going back in. But unfortunately, it's a pretty common myth, and it's a term that's used a lot amongst the general population, so it persists. So to give you a bit of an idea, this is a really typical picture from an anatomy book, the one on the left, and it gives you the impression that the discs are quite separate to the bone. You know, if you can see, you know, the individual discs in between the vertebral bodies, you could be forgiven for thinking they were quite separate. But when you actually see a spine in real life, a real life spine with real soft tissue attachments to it, it's nothing like that. It's a lot more bound together and blended. And even this picture of the disc, it gives you a bit of an idea of the structure of the disc. And in really young people, that's exactly how they look, with the annulus, the thick fibrous annulus, and the nucleus in the centre. But it doesn't stay that way. It changes and it becomes more blended. And I think the other thing that's important to remember too is the annulus is really quite resilient, is quite tough. And whereas we, and me included, at times have thought of the disc as being a fragile kind of structure, and they're actually not. They're quite tough. The annulus is quite a tough tissue. So compare that to this picture, which is getting a little bit closer to how it is. And you can see how, compared to the last one, there's a lot of binding together that goes on, and this is just still a fairly basic version of it, but there's lots of ligamentous attachments, there's lots of blending, there's muscle attachments everywhere. There's nothing that is possible to go out and come in. It's a really tightly bound structure, the spine.